Hey everyone! It's Dr. Sandra Lee, here to talk about something really important: breast health. Just like catching a pimple early can save you from a bigger problem later, early detection is crucial when it comes to breast cancer. We all know someone affected by this disease, and knowledge is power. That's why, in this video, we're going over 10 early signs of breast cancer that you absolutely should not ignore. Remember, I'm not trying to scare you, but to empower you. So let's get right to it. Okay, let's start with the most well-known sign: a lump in the breast or armpit. This is often the first thing people notice, and it can be quite alarming. But remember, not all lumps are created equal. Now don't panic just because you feel something. It's important to stay calm and take a measured approach. Many lumps are harmless and can be due to a variety of reasons, such as hormonal changes, cysts, or fibroadenomas. Most lumps are actually benign, meaning they're not cancerous. In fact, studies show that a significant percentage of breast lumps are benign, especially in younger women. However, it's crucial to get any new lump checked out by a healthcare professional. But, and this is a big but, you should never ignore a new lump or bump. Early detection is vital in managing any potential health issues. The sooner you identify a problem, the better the chances of effective treatment. Imagine it like this. You see a new bump on your skin. You don't just hope it goes away, right? You monitor it. You might even take pictures to track any changes. This proactive approach is essential for your breast health as well. You keep an eye on it, and if it changes or bothers you, you see a dermatologist. The same principle applies to breast lumps. Regular self-exams can help you become familiar with your own breast tissue, making it easier to notice any changes. Same goes for your breasts. Make it a habit to perform self-exams monthly, ideally a few days after your menstrual cycle ends, when your breasts are least likely to be swollen or tender. If you feel a lump that's hard, immobile, or just doesn't feel like the rest of your breast tissue, it's time to schedule a visit with your doctor. These characteristics can sometimes indicate a more serious issue that needs professional evaluation. Early detection is key, and getting checked out can give you peace of mind. Remember, it's always better to be safe and get a professional opinion. Your health is worth it. Our bodies are constantly changing, evolving with time and age. This natural process includes various parts of our body, and yes, that includes our breasts. Breasts can change due to hormonal fluctuations, weight gain or loss, and other factors. But sudden or dramatic changes in the size or shape of your breast can be a red flag. It's important to be aware of these changes and understand what might be normal and what could be a cause for concern. Think about it like this. You have a mole that suddenly changes shape or size. You'd get that checked out, right? The same principle applies to your breasts. If you notice one breast becoming noticeably larger or smaller than the other, or if you observe any unusual swelling, don't ignore it. These changes could be benign, like a cyst or a benign tumor, but they could also be indicative of something more serious, such as breast cancer. It's crucial to pay attention to your body and trust your instincts. If something feels off, it's always better to be safe and get it checked by a professional. Regular self-examinations can help you become more familiar with your breasts and notice any changes early on. It could be nothing, or it could be something. The best way to know is to get it checked by a professional. Early detection is key in managing any potential health issues. Remember, you know your body best, so trust your gut if something feels off. Don't hesitate to seek medical advice if you notice any changes. Your health is worth it. Stay vigilant, stay informed, and take charge of your health. We all know about dimples on cheeks, but did you know that dimpling of the breast skin can be a sign of breast cancer? This happens when a tumor pulls on the ligaments within the breast, causing the skin to dimple or look like the peel of an orange. It's subtle, but it's important. Imagine you're stretching out a piece of fabric, and you pull on one spot. It creates a dimple, right? That's kind of what's happening here. So, if you notice any unusual dimpling, puckering, or indentation on your breast skin, please get it checked out. Okay, let's talk about nipple discharge. Now, I know this might seem a little awkward, but it's important. Nipple discharge is actually quite common, especially during pregnancy or breastfeeding. But if you notice any discharge that's bloody, clear, or just doesn't seem normal, it's time to see your doctor. Just like with any other bodily fluid, changes in color, consistency, or amount can be a sign that something's up. Don't be shy. Talking about it could save your life. We've all experienced dry skin, but But when it comes to your breasts, it's important to pay attention to any persistent changes. While dry skin can be a common issue, especially in colder months or due to certain skincare products, persistent redness and flakiness on the breasts can be a sign of something more serious. It's crucial to differentiate between ordinary dryness and symptoms that could indicate an underlying health issue. Redness, flakiness, or thickening of the skin, especially around the nipple, can be a sign of inflammatory breast cancer, a rare but aggressive form of the disease. Unlike other types of breast cancer, inflammatory breast cancer often doesn't present with a distinct lump. Instead, it manifests through changes in the skin's appearance and texture. This makes it even more important to be vigilant about any unusual changes. Think of it like this. Your skin is a barrier, and when it's irritated or inflamed, it's usually a sign that something's trying to get through. This could be an infection, an allergic reaction, or, in rare cases, cancer cells. The skin on your breasts is particularly sensitive and can react to a variety of internal and external factors. Understanding these signs can help you take timely action. So, if you notice any persistent skin changes on your breasts, don't just slather on lotion and hope for the best. While moisturizing can help with ordinary dryness, it won't address underlying issues that could be causing the redness and flakiness. Ignoring these signs or delaying a medical consultation can lead to more serious complications down the line. Get it checked out by a doctor to rule out anything serious. Early detection is key in managing any potential health issues, including inflammatory breast cancer. A healthcare professional can provide a thorough examination and recommend appropriate tests to determine the cause of your symptoms. Remember, it's always better to be safe and get a professional opinion rather than dismissing persistent changes as just dry skin. You know those little lumps in your neck that swell up when you're sick? Those are your lymph nodes, and they're part of your body's immune system. Well, you also have lymph nodes in your armpits and around your collarbone, and swelling in these areas can sometimes be a sign of breast cancer. Think of it like this. Your lymph nodes are like little filters that trap germs and other harmful substances. When they swell, it means they're working overtime, and it could be because they're fighting off cancer cells. So if you notice any persistent swelling in your armpit or collarbone area, don't ignore it. Now, I know what you're thinking. Pain is subjective, right? And you're absolutely right. But persistent pain in the breast or nipple that's unexplained and doesn't go away is something you should never ignore. It's like a fire alarm going off in your body. It's trying to tell you something's wrong. While breast pain is often caused by hormonal changes or benign conditions, it can also be a sign of breast cancer. So, if you're experiencing persistent pain, don't tough it out. See your doctor to get it checked out. Nipple retraction is when your nipple turns inward or becomes inverted. It can happen naturally, but it can also be a sign of breast cancer. Imagine you have a piece of tape on your finger and you pull it off. Your finger might retract a little, right? That's kind of what can happen with nipple retraction. A tumor can pull on the tissue behind the nipple, causing it to retract. So, if you notice any changes in the appearance of your nipple, especially if it's new or persistent, don't hesitate to see your doctor. We've all experienced itchy skin, but did you know that persistent itching or scaliness around the nipple can sometimes be a sign of breast cancer? It's called Paget's disease of the nipple, and it's a rare type of cancer that affects the skin of the nipple and areola. It can look like eczema or dermatitis, but it doesn't go away with over-the-counter treatments. So, if you're dealing with persistent itching, scaliness, or crusting around your nipple, don't just scratch and ignore it. See your doctor to get a proper diagnosis. Okay, this last one might seem a little strange, but unexplained weight loss can actually be a sign of many types of cancer, including breast cancer. When your body is fighting off cancer, it uses up a lot of energy, which can lead to weight loss. Now, I'm not saying that if you lose a few pounds, you have cancer. But if you're losing weight without trying, especially if it's a significant amount, it's important to see your doctor to rule out any underlying medical conditions. That was a lot of information, but I hope you found it helpful. Remember, I'm not trying to scare you, but to empower you to take charge of your breast health. If you notice any of these signs, don't panic, but don't ignore them either. Schedule an appointment with your doctor to get checked out. Early detection is key when it comes to breast cancer, and the more you know, the better you can advocate for yourself. So, be proactive, be informed, and be empowered.